everybody. My name is Marcy Chen. I'm the unemployment insurance program lead at US Digital Response. I always do that. And this is my colleague, Mindy.
Hey everyone, I'm Mindy. I am a product manager at USDR. Prior to joining USDR, I actually rotated through here on a 6-month fellowship basis with the Google.org program. I'm really excited to have transitioned from that to work here full time. So I'm excited to talk to you all today about some of the work that USDR volunteers and Google.org fellows did together in the UI space.
And so we want to make this session as interactive and engaging as possible. So we really want to encourage everybody to be active in the chat, share your reactions with us in real time, share any personal stories that you're willing to tell. We're going to have a couple of polls in our roughly 35-minute presentation, and we'll have time for Q&A at the end. So if any questions come up during our presentation, feel free to add those to the Q&A panel, and we can address it when the time comes. And so we'll get started. So we were so excited when we saw this year's summit themes, building the path forward together, human-centered government, policy and technology being two sides of the same coin. And we immediately thought of a project we completed last year under the guidance of the US Department of Labor, where a team of USDR volunteers and Google.org fellows were tasked with designing a way for state workforce agencies to be able to reach a large number of people all at once to gather information from them quickly and accurately. We'll share how our approach with using human-centered design and low-code technology ultimately ended up influencing unemployment insurance policy at the federal level. So not only reducing what could have been months, if not years, of administrative burden for state workforce agencies, but also preventing potentially millions of unemployment insurance claimants from having to repay compensation that they rightfully deserve. But before we talk about the work, I want all of us to go back to March of 2020. Think about where you were, what you were hearing, what was your work situation like? How were you feeling? So for myself, I can remember it really vividly. I was contracting at a fund design agency in Brooklyn, working on a project for a major airline. And the day after the stock market crashed, that airline cut all of their non-essential budget items, including our design project. So I, like 1.5 million other New Yorkers, found myself suddenly out of work and applying for unemployment. And if you all remember New York City, we suffered that first domestic wave. So on top of losing work and hiding from the virus in my tiny Brooklyn apartment, I remember hearing ambulance sirens 24 hours a day for 8 weeks straight as COVID cases overwhelmed our hospitals. That followed by 2 weeks of nonstop helicopters as millions of people across the country protested against police brutality and in support of the Black Lives Matter movement. So that spring going into summer it's still really hard to describe, and it's still harder to process 2 years later. And I know that everybody experienced this period of time very differently. As a contractor, I was eligible for one of 3 new unemployment insurance programs that were introduced by the federal government, in addition to regular state UI. These programs were created to provide emergency assistance to workers like myself who, under normal circumstances, would not be eligible for regular state UI. And those 3 programs were pandemic unemployment assistance, pandemic emergency unemployment compensation, and federal pandemic unemployment compensation. By April of 2020, 22 million people across the country applied for unemployment. That peak you see there on the screen, that event is what our government partners refer to as the tsunami. Many of those 22 million claimants included first-time filers, many of whom were applying to one of those 3 new programs that didn't exist before March, and many of them were unfamiliar with how to navigate government systems. And so now we want to start our first poll, and I want to get a sense here and see how many people in the audience today have ever collected or applied for unemployment benefits. And we also want to see how many people, if not yourself, how many people know somebody who has, whether it's a family member or a friend, coworker. So if you go, I think, into the polls tab on the right-hand side of your screen, there's a poll there where you could select one of three answers. But it looks like a lot of people in the chat. Oh, poll is disabled. I wonder if our tech moderator can help with that. So in the meantime, throw your answers in the chat. We can see those. And it looks like a lot of us in the audience have either directly or been indirectly impacted by this really important social safety net program. So also during this time, New Jersey Governor Phil Murphy was quoted saying there has been a surge of claims is literally the understatement of the century. In just 1 week that April, over 200,000 people in New Jersey filed for new unemployment claims. Hawaii and Nevada are two states whose economies are largely dependent on tourism, were two of the hardest hit. Hawaii, for example, in February of 2020 had the lowest unemployment rate in the country at 2.7%. And by April, they had the highest at 37%. When that tsunami hit, unemployment websites across the country crashed from this unprecedented load, and unemployment offices either closed or found themselves inundated with unemployed people lined up around the block. People were unable to access the benefits they desperately needed, and unemployment agency staff were dealing with chaos. And keep in mind that the people on the other side of those websites, on the other side of those support calls who are trying their best to serve claimants at this time were also dealing with all of the same pandemic stressors as the rest of us. So this unemployment situation, along with that urgent need to track COVID infection rates, PPE supply chains, and create mechanisms for contact tracing, was the context in which USDR was founded. We are a nonprofit organization founded in March of 2020 in response to the COVID-19 pandemic, when a group of civic technologists joined forces with some of their private industry tech friends and asked, how can we help? They started by posting a sign-up form online, and within the first month, nearly 4,500 technologists from across the country, including myself, signed up to volunteer. We connect highly skilled volunteer technologists with government agencies in moments of crisis. Our engagements are scoped to last anywhere from 6 to 12 weeks, and we cover a broad range of work that generally falls under the umbrella of tech, including software development, design, research, or even helping to set our partners up with low-code tools like Airtable or Jotform. Our aim is to provide support to governments to help them serve the most immediate needs of the public. And since March 2020, USDR has worked with more than 200 government agencies across 37 states. We've completed over 300 engagements and deployed more than 850 volunteers out of a pool now of over 7,000. And through the impact of our work, we've built credibility with our government partners and have proven that the volunteer model works well in a rapid response context. Our unemployment insurance program has worked with 9 states so far. And as our organization and programs mature, we're looking for opportunities to scale our rapid response work in ways that will see longer term change. And we offer 3 takeaways on how we can plant those seeds for long-term change today. The first, modernizing government means policy and technology inform each other. Second, low-code tech can be a secure and low-cost path to scaling quickly. And third, rapid research can produce small wins that add up to systemic change. To illustrate our first takeaway, we'll share an example of how we're using our rapid response work in unemployment insurance to see long-term change by shifting that relationship between unemployment insurance policy and the way people interact with the unemployment insurance systems in their state. And we'll demonstrate how this traditional top-down model between policy and delivery broke down during the pandemic. And so the problem we were solving in the project we'll discuss today, it manifested at that intersection of policy and delivery, ensnaring both claimants and state workforce agency staff. And it revolves around this fundamental question: what does it mean to be able and available to work? To help us understand the nature of this problem, I'm also going to back up just a bit and give us a brief overview of two issues that lie at the core. The first related to standard federal eligibility requirements, and the second related to retroactive eligibility determinations. So to start at the basics, unemployment insurance programs are regulated by the federal government and administered by the state. And it's the perfect example of this traditional top-down policy and delivery model. And one of those federal regulations requires that an individual must be able and available for work. There's a version of this question that you see here on the screen that is required in every unemployment compensation form in every state and territory. The version we have here was taken from Washington State's website, for example. Were you physically able and available to work each day? Unemployment insurance claimants are required by federal law to certify on a weekly basis whether or not they were able and available to work, and they must answer yes in order to be eligible to receive compensation. So now we're going to try our second poll. So let's see, get that published. This time I'm going to give you all a bit of a pop quiz. So again, going back to March of 2020, when we knew very little about the virus and how it spread. So remember, we were all washing our groceries or masking up on our outdoor walks. So if you became unemployed or your hours were drastically reduced during that time, say your company shut down, downsized, or you couldn't work because you had to care for sick family members or for children who had to stay home due to school closures, how would you answer this question? And no spoilers if anybody knows where I'm going with this. I really want to see how many people answered this question the way I did. How's this poll working now?
There's a lot of folks answering. So if you go to the poll tab, you should be able to see it. Marcy, you'll need to hit the show results button or answer it yourself in order to see the results.
No wonder. Okay. Wow. Okay. So most of you are saying no so far. Okay. So while we're conducting this pop quiz, we'll go over some definitions of what exactly does it mean to be able and available for work. The Department of Labor defines being able and available pretty broadly, and they intentionally leave it up to each state and territory to provide their own definitions. Here are some examples that I found on Pennsylvania's website and from an unemployment insurance fact sheet from the state of New Mexico. And I don't want you to read what's on the screen, but just notice the difference in the amount of information provided in each example. The point here being that not only does each state have different criteria, though largely similar, for what it means to be able and available, but that level of guidance provided to claimants who are required to answer this question as a critical determination of their eligibility can vary. But what does it mean to be able and available in a global pandemic? So going back to our poll results, this is actually more than I would guess. 80% of you all answered no. I answered no when I was applying for, when I was doing my weekly certifications, because I'm like, well, who's able and available to work during a global pandemic? We're stuck at home right now, right? And so we don't have access yet to the data, but we do know that the number of people who answered no in some states was in the hundreds of thousands. And at the very least, we know that it was a significant enough number of claimants, including myself, that answered no, that many states decided to award compensation to them anyway, even though it would put the state out of compliance with federal law. So at this time, states were already scrambling to implement those 3 new UI programs as fast as they could, and they just did not have the capacity to follow up for clarification like they normally would. It would have been impossible for them to talk to each and every claimant who needed assistance at that time, let alone to each and every claimant who answered no to this question. And to make matters worse, so many state UI systems are running off of decades-old brittle systems, which really prevented them from being able to move as quickly as they needed to when that tsunami hit. People needed relief, they needed it fast, and states made the call they thought was in the claimant's best interest. So how did people answer this question and why? This is what we heard from the claimants that we interviewed when given a hypothetical situation about childcare. So first, we asked them how they would answer if one, they are a primary caregiver and they don't have access to childcare, and they correctly answered no. Then we asked how they would answer if they are a primary caregiver for a child who is at home due to a forced school closure directly related to the pandemic, and you don't have access to childcare. They still answered no. We know now that a lack of childcare due to school closures during the pandemic was in fact an allowable reason. But expecting people to make that leap between understanding that this is an allowable scenario and answering yes to this question was just too much. Granted, the percentage of people who answer no is typically very small, but in the context of the pandemic and these updated DOL guidelines, so many people got it wrong, and it's really not their fault. To be fair, the Department of Labor did make an early effort to provide some guidance in this area. And so what you're seeing here on the screen is an example of a UIPL, which is insider lingo for unemployment insurance policy letter. These letters are sent to state workforce agencies whenever the Department of Labor needs to issue a new directive or update policy for how states administer their UI programs. And this one in particular was issued on March 12th, 2020, specifically to provide guidance to states around how they might reinterpret existing eligibility requirements in the context of COVID. It includes scenarios that they consider allowable under that able and available requirement, such as the childcare scenario, or if a workplace temporarily shuts down due to COVID-19, or if an individual has to quarantine as a result of COVID-19. It also reminds states that they still ultimately have flexibility in determining what it means for an individual to be able and available during the pandemic. However, the law still requires that a claimant must answer yes to this able and available question in order to receive compensations. And states violated this policy by granting compensation to all those people who answered no. So this brings us to the second aspect of the problem, which involves retroactive certification directives, which are issued by the DOL to bring states back into compliance with federal law. So these directives are also known as retroactive fact-finding, and in our attempt to use plain language, we're calling them retroactive eligibility determinations, but also open to better suggestions if anyone can throw that in the chat for us too. The bottom line is that because states broke compliance by awarding compensation to claimants who answered no to this question, now they have to reach out to all of those claimants and have them recertify for each of those weeks they answered no and received compensation that is now technically considered what they call an overpayment or improper payment. States we've spoken to report that an undertaking of this scale with the means and resources they currently have could take months, if not years, of working through a backlog of tens of thousands or even hundreds of thousands of phone calls and letters with no guarantee that claimants will even respond. For claimants, this means having to individually recertify each week they answered no, which for a program like Pandemic Unemployment Assistance, for example, could be as many as 86 weeks. This would involve making sure they understand why they are being asked to recertify, making sure they understand how to answer that able and available question correctly this time around, having them recall which weeks they either were or were not able and available to work, and having to recall why they were claiming benefits for each of those weeks, which over the course of potentially 86 weeks could have been for multiple reasons. And this would all be for compensation that they may have received almost 2 years ago by now. Compensation that is inaccurately being classified as an overpayment, which is likely to confuse claimants even more, and even worse, make them worry about being penalized. What we found was that not only did COVID cause a massive shift in how people access their unemployment insurance benefits, it also uncovered how this key eligibility question might not be useful in its current state. It was both confusing people and creating massive inefficiencies in agencies' ability to quickly deliver benefits to people in need. While the original intent of the question is supposed to verify that each claimant is in fact in need of benefits that the program was designed to provide, this top-down approach with policy and delivery ended up compromising the very purpose of the program's existence, which is to serve people in a time of crisis and vulnerability. Our partners have told us that knowing all this now, they can't believe they didn't see this problem coming from miles away. And now that we're here, how do we solve a problem like this? And so now I'm going to turn it over to Mindy, who will introduce our second takeaway and walk us through the proof of concept and the research created by our volunteers and Google.org fellows.
Thanks, Marcy. So to reiterate what our second takeaway was, it is that low-code technology can provide a secure, low-cost path to scaling a solution quickly. This is a very strongly held value that we have at USDR, and I would love to walk you through next an example of how we applied low-code technology to solving this problem of gathering and recertifying hundreds of thousands of people for the able and available eligibility. So next. The goal of this project, again, was to quickly survey over 100,000 people per state on the able and available status through the pandemic. And for this solution, we had two main types of users, right? We needed to build a tool that both worked for the state workforce agencies. So workers here, they needed to be able to continuously send out these forms to new claimants. They needed to be able to track and fill out, track who's received and who's filled out the form since then. And then they also needed to be able to retrieve information out of those responses in a useful format for the rest of their systems. Our second type of user was the claimants themselves. And while there's only a single bullet point here, I want to stress that is a very important bullet point. Having an easily readable and also reliable and robust form to fill out, that was what the claimants needed in order to get this information back to the states. So how did we solve for these requirements, right? So we worked closely with the Department of Labor and chatted with a few states and came up with a fast, low-cost, scalable solution that we built on top of many existing tools in the space. So let me walk you through it really quickly. The first step of our solution was to have our state partners put claimant email addresses, contact information, all of that into an Excel spreadsheet and upload it to our tool. Our tool would then use that information and send out emails using SendGrid, which is an email sending service to automatically every day shoot out new forms to any new emails that were uploaded recently. These forms that we sent out were built on JotForm, which is another piece of software that streamlines the process of building and sending out great forms. The claimant then clicks on the link, fills out the form, and our tool automatically takes their response, translates it back into a format that's useful for the state worker, and the state worker is able to export that information as an Excel file back out. Now, there are three main points I want to touch on about this solution. Next page, please. Number one is that Excel and CSVs, they are a great point of integration for a lot of Civ type projects. This is not something just for this project. We've seen it over and over again across different projects at USDR. CSVs and Excel is a familiar and ubiquitous file format across all governments that we've worked with and across most processes that they currently use. Basically, if you're able to import information as CSVs and get information out of your tool as a CSV, it's going to be so much more likely that your tool will be actually useful for the end user. Next, I want to say, don't reinvent the wheel, right? Use what's already built. We built on top of SendGrid and JotForm, and that made the process and the speed of which we built this out way faster and way easier, because at USDR, we have no need to rebuild an email sending platform. We have no need to build out a form themselves. These are things that seem small and modular, but actually take a lot of thought and design to do it very, very well. So build on top of what already exists in the system. And last but not least, I want to touch on the code parts of what low code, right? So we do have some code in our system. It's not completely no code. What we have are a few chunks of logic that we built on Amazon Web Services. And these chunks of code do things such as sending out the emails every day through SendGrid and automatically taking the responses that are coming in and translating them back out into a format that the state can download in an Excel sheet. I also want to stress that the low part of low code, that's also very important. The total size of the code across all these chunks of logic is about 150 lines. And to put that into perspective, for comparison, the front page of covid.gov has about 500 lines on it, without logic included. So again, very low code, very fast to build because we stitch together a lot of existing formats that people are familiar with or is easy for people to get up to speed with. And next, I want to quickly also dive into just one part of that solution, which is the form. I want to do this because forms are a pretty common solution to a varied amount of problems. And I really want to show you how easy it can be to create a form that's both easy to read, easy to use, and also compliant. So let me share my screen real quick. There we go. So what you're seeing here is the form that we built in conjunction with the Department of Labor. This is the form that would be sent out to claimants for them to recertify their able and available status throughout the pandemic. And I'm going to scroll through a bit here. So what you're going to be seeing is a lot of legally compliant text. And hey, it's a lot of text, but as you all know, this text is very important. Usually, this type of text is written by a policy person in conjunction with a legal person. Now imagine that you didn't have a no-code solution, you didn't have JotForm, you needed to build your own form. That meant you also needed a technical person in the mix to help translate that text and build that into a survey for you to be able to send out to people. However, if you do use an existing no-code solution such as this, it makes it easy for a staffer to iterate on the form themselves. You don't need that technical person in the middle anymore. This just allows work to be done a lot faster. I also want to show you a few different ways that at least JotForm as a platform is able to take inputs. So I'm just going to put in some dummy data here. Go to the next page. I want to show you some other features here. So you'll see that based on the prior answers that I put in on the other page, we are actually able to conditionally change our answers here, or change the text and the content here, right? So as I go through, and I hit yes for one, you'll see that different questions pop up. If I hit no, then I just keep going straight through. JotForm has this feature to allow you to conditionally show different contents based on prior answers. And this really allows you to easily use form design best practices, such as only using the respondents, only showing respondents questions that they need to answer, and not overwhelming them with a bunch of questions that they actually don't need to see, right? So I'm going to put in a bunch of no's and go on to the next page. So I'm going to skip over to this final one because I want to show you here how JotForm already has a lot of pre-existing components that you can just drag and drop into the page. So this is the certification page, and like any good certification page, you're going to need your name, you're going to need the dates, right? And you're going to need a signature. JotForm already has all of this pre-existing, so you can collect the name. There's a really nice date picker situation that they've got going on here. You can even sign your name really terribly, like me. Oops, there we go. And again, I want to stress that these are all features that already exist. You don't have to rebuild it. A non-technical person can put it all together. Now, when you hit submit, you'll see a thank you page. And also, JotForm will send out an automated email to the respondent, thanking them, telling them that their submission has been received. And you're able to customize that language to let them know how long it will take for you to, how long it will take for them to expect a follow-up from the state worker. So in summary, Jotform is just one example of a no-code form building solution. It's definitely not the only one out there. And these no-code solutions make it easy for everyone, even non-technical people, to quickly create really awesome forms. Forms, again, a very common solution to a lot of problems. All in all, I wanted to reiterate that tech can be fast, low cost, and secure to build. Right? When I say fast, I mean that this whole solution, front to back, took about 1 month with volunteers working less than 10 hours a week. It's fast to onboard people as well, because again, with these no-code solutions, they've already got a great UI up there. Minimal staff training is needed to train them. When I say low cost, I mean that we specifically chose SendGrid, Jotform, and AWS as tools within our solution because they have generous free tiers. Free tiers means that you're able to develop your solution and just test it out without needing to pay anything up front. And once you do go beyond and exceed what the free tier can offer, it is pay per usage, pay by usage. And this is pretty typical pricing strategy for all low cost or low code or no code solutions in the space. And of course, security is always top of mind for the public sector. So specifically, AWS is FedRAMP, SendGrid is SOC 2 certified, Jotform is HIPAA and PCI compliant if you do need to collect medical and payment information. You can, yeah, all right, next page. So what was the result of building out this demo on top of all of these no-code, low-code tools? The result was within a month, we were able to get a demo in front of the Department of Labor, get approval for them to start shopping the solution around the states to help them alleviate the administrative burden that was going to result from able and available. Now, while we were building out the solution, we were also conducting research on the side to help inform what content was going to go into the form side of things, the survey side of things, right? And this leads us straight into our last takeaway, which is that this type of rapid research can produce small wins that leads to systemic change. So for this section, we want to illustrate how the insights produced from the usability testing influenced federal UI policy at the end, and offer that as an example of what a modern relationship between policy and technology can possibly look like. So when we first approached this problem, our Google.org fellows took a look at this and asked, how might we design a form flow and content strategy that will help claimants understand how to correctly answer the eligibility question, the admittedly very confusing eligibility question around whether you are able and available. Of secondary concern was the question, how might we prevent eligible claimants from answering the question incorrectly so that they do not end up repaying funds that they do rightfully deserve? So our UX designer approached the design problem with these three objectives in mind. Number one, we needed to explain what able and available meant. Number two, we needed to confirm the time periods for which the user was not able and available. Number three, we had to gather the reasons for why users were not able and available. You saw an example of one way how this played out in the Jotform demo that I demonstrated earlier. And after more than 6 different design and content strategy approaches, lots of brainstorming sessions, conducting 4 pilot usability tests. Are you guys ready for this? This is the ultimate insight that we found. This is going to change your world. It turns out that it didn't matter. No matter how much or little information we provided about able or available, no matter where in the flow we introduced this information, no matter how we framed it, no matter how we added in COVID-19 factors, what examples we gave, it turned out that claimants still simply answered the question based on their preconceived understanding of what it meant to be able and available to work. Simply put, no matter what we do, it was not changing their behavior. And this sounds super depressing because nothing we did was helping the claimants answer it correctly. But the research was still really, really important. And it was important because two things came out of it when we presented it back to the Department of Labor. Number one was they said back to us, we didn't even know there was so many ways to approach this problem. What the heck? What is this 6 different design and content strategy approaches? How did you guys do 4 usability tests? Like, what is all this? So that was really cool to hear. They were saying that, hey, look, even our policy team is giving you guys a thumbs up. What this meant was we introduced them to a new way of problem solving and a new way of thinking about these types of problems. That was the first really cool thing that happened. The second really cool one was they actually took a look, they listened to us, and they came back to us and said, we knew this. We knew that it was going to be so hard to explain what able and available meant. But you know what? Now you've given us the evidence for it. And that evidence is super important. And I'm going to turn it back to Marcy to explain the impact that the evidence had.
Thanks, Mindy. So we're so happy to report that in part due to our research and prototyping efforts, the Department of Labor issued this UIPL on February 7th of this year. So just almost a little over 3 months ago. And I promise this will be the last UIPL I will make you all look at today. But it states that the scenario in which an individual answered no to being able to work and available for work, and the state paid PUA or PEUC without adjudicating the eligibility issue, is now an allowable scenario where states may issue a blanket waiver for recovering such overpayments. That's essentially legalese for states will no longer have to ask claimants to recertify their eligibility for unemployment insurance if they answer no to being able and available for work, which means that claimants will also be spared from having to fill out yet another complicated form and worry about having to repay potentially thousands of dollars that they're entitled to. And it's also important to note here that as of today, these blanket waivers only apply to these 3 new pandemic UI programs, and states may still have to conduct retroactive eligibility determinations for people who answered no in their regular state UI claims. However, this is still a big win, as the people who qualified for these pandemic UI programs represent contract workers, part-time workers, seasonal workers, and people who have exhausted all of their other available means for relief. In other words, those who experience more vulnerability in unstable economic conditions, those who tend to be Black, Latino, Native American, and those who tend to make lower wages. So far, we've seen New Jersey, for example, issue related blanket waivers for over 250,000 claimants in their state. Massachusetts recently announced $349 million in PUA overpayments are going to be waived. And just last week, Michigan announced that at least 55,000 claimants in their state will not have to pay back a total of approximately $431 million in these so-called overpayments. $431 million that will remain in the pockets of the people who need that money to get by. And all of that as a result of that UIPL issued in February. So this is just one powerful example of what a modern relationship between policy and technology, or in this case, between policy and the research arm of human-centered design, could look like. These conversations are so important right now because through grants funded by the American Rescue Plan Act, states are now in various stages of investing in improving and upgrading their unemployment insurance systems. This includes making their technology more robust and resilient, making their content more accessible with plain language, and also available in more languages for non-native English speakers, and creating and expanding their digital innovation teams. And in addition to those critical efforts, modernizing unemployment insurance means shifting the relationship between policy and the technology that delivers it, from a top-down approach to one where they inform each other. In this model, government bureaucracy, which we know exists for a reason, becomes less of a burden that prevents governments from moving more quickly. Projects like these not only underscore the need to operate in a new and more collaborative way, They also provide a blueprint for how to do so and proof that it works. We've also identified how low-code tools can be a secure and low-cost way to reach a large number of people in a short period of time without the need for costly vendor contracts or for long-term maintenance considerations. And we've seen how research can make policy more effective by bringing policymakers, who tend to be the most removed, closer to the claimant experience, and by giving governments the data they need to make informed decisions that ultimately make their programs more successful. We've been told by several of our partners that the research insights we've produced have helped them to have more productive conversations with their leadership. It's helped them to guide conversations around how to anticipate and avoid future problems, and overall has increased their confidence in how they execute federal policy. It's when we're able to interweave these solutions with policy as it's being developed that we can see the beginnings of systemic change. So next, we want to thank all of you for joining and engaging with us today. And we also want to shout out the team who did most of the work you saw today. So our Google.org fellows, our volunteer teams, and a big special thanks to our advisory team at the U.S. Department of Labor. We want to thank them for sharing their expertise with us and for being open to our ideas, especially some of the more out-of-the-box ones. And this work is just one part of our broader mission. So we'd love to end by sharing our vision with you, which is that of a modern unemployment insurance system where workers can access the benefits they need quickly, safely, and confidently. One more. And so if any of these problems resonate with you, let us know how we can help. The able and available issue is not the only retroactive issue that states will have to address in the near future. And we have a proof of concept to show them how it can be done. We're ready to work with more states to help them get through their backlog of retroactive eligibility issues and to provide support in the full range of efforts underway in making unemployment insurance more accurate, timely, and equitable. So if you're a state that wants to leverage the tools we've created or inquire about other ways we can support your work, or if you're interested in volunteering on projects like these, you can contact us at our website at usdigitalresponse.org. And so now it looks like we have about 15 minutes left for Q&A. So thank you, everybody, again. This is really, really fun.
Looks like we have a bunch of questions in the Q&A here. Folks, if you see a question that you're particularly interested in, do give it a thumbs up. That'll help bump it to the top of the queue that I have here. And that'll make sure that we can answer the questions that everyone is interested in.
I can start with that top one. How did the partnership with the Department of Labor work? It was an advisory relationship. So, we were made aware of this problem that needed a quick solution. And as we developed the prototype and conducted the research independently as USDR and working with our Google.org fellows, we shared this work in tandem with our DOL advisors and got their feedback. And also that was really important because, as Mindy mentioned earlier, one, it was showing to them a new way of problem solving, but also it helped us to feel confident that the work that we were creating was compliant with federal policy, which would then make states more confident in potentially partnering with us on this work. Question.
I'll take the next one. The one from Mark is super highly voted right now. What have you been able to learn about managing the ongoing care and feeding that even low-code systems require? Do low-code systems also typically have a lower support burden? So this is a really cool question, and the answer is we've learned a lot. So USDR, from the very beginning of the very inception, we wanted to rely largely on low-code solutions, and that is because these solutions are because USDR we are largely Marcy, where'd you go? Largely organized by teams of volunteers helping with various engagements. We knew that whatever we built, it had to be a super low maintenance cost. We wanted something that we were able to hand off to government partners and they would be able to take care of themselves. We found by using low-code solutions, not only was there less maintenance costs, but also we were able to train even non-technical folks on how to continue maintaining it, building out new features, continuing using it. So, for example, in our work in emergency rental assistance, there was one workflow that we built using Airtable that replaced, we used Airtable to replace some manual spreadsheets that folks were building. We were able to automate some of the processes. It had more like data structures and information hierarchy built into Airtable. And a really gratifying testimony that we heard from our partners was one day as the volunteers was rolling off, the partners got a question from a coworker, and they were thinking to themselves, "Oh no, how do I implement that? Is that something we can do? Like, what are we going to do now that the volunteers are rolling off?" And then they suddenly had a realization, "Wait a second, I know how to do this. I can do it myself." And then they went ahead and just built it. This was just your normal office worker, not someone who was technical at all. So this is the kind of stories that we see come out of using and building off of low-code solutions, which is why we are such a strong proponent of it. Ooh, Justin, that is a spicy question. We often get steered back to Microsoft products. Is this relevant to you also? How do you make the case to use something other than Microsoft Office 365? The answer is we do see a lot of partners who are on Microsoft products. This is a very common occurrence. We do have some projects that are built specifically through Microsoft products. We've helped partners build things out through SharePoint, a lot of Excel. Excel is king in this space. But what we've also seen is what inspires partners to change, what is most inspirational and most catalytic for them to change is to see examples from other similar types of governments that are using different systems. So once it's kind of like a first mover thing, everyone wants to be second, people are hesitant to be first, but as soon as they see one state government is using Airtable, or like one local county government is using JotForm, it becomes a lot easier to point to that that case study and make the case to also switch over. So I would suggest that as a possible approach.
Thanks, Wendy. I think I can take this next one. How was the approval process for each of the tools in terms of getting buy-in, security, privacy review, speed, etc.? Did we need ATO? I'm not familiar with what ATO is. I'm not sure. Wendy, is that familiar to you?
Authority to, I forget the exact
operate. Okay. Thanks, Shannon.
There we go.
Thanks, Tina. Oops, let me go back to the question. So the approval process, so as far as the Department of Labor was concerned, they just wanted to make sure it met, those existing federal security guidelines. But when it comes to each state, the plan would be during the onboarding process to understand what their approval process looks like and to work with them on whatever that looked like for them. And so buy-in, security, I feel like all of those things would also depend because every state infrastructure is set up so differently. And so what we have is the proof of concept to show that it's fast, that it works, that it's secure, and that it's low maintenance. But really, when it comes to onboarding with a specific state partner, it would be customized by our team, our volunteer team, to make sure it works for whatever infrastructure is they have set up. So I hope that kind of answers your question. The approval process is kind of TBD depending on the state that we're working with. And I'll go into Oh, go on, Mindy.
I wanted to call out Tina Walla, who is one of our executive team at USDR. She has posted a link in the chat. If you're interested in learning more about our experience introducing low-code and no-code tools to government partners, we do have a series written by our CTO, and she's linked it in the chat. So check that out if you're interested in that.
And this next question is a great question that it's being talked about a lot right now. Since UI benefits are state by state, how is USDR and the Department of Labor sharing best practices, templates, code across the states? So I don't want to speak too much for the Department of Labor, but I will say that they do have a newly formed unemployment insurance modernization team that is looking into exactly these questions and trying to figure out how they can best serve states and make each of the state programs successful. And from our perspective as a nonprofit, this is one of our main approaches or principles is that, how can we create things that can be reusable and shared with many states? And so we'll take the rapid response work that we've done, and for one state partner, for example, a recent one we did related to another retroactive eligibility issue, but this is a good one because it was one that could potentially give people more money instead of potentially making them pay back more money. And so that one was really exciting because we did content strategy for them, we did form design, but we also got to do research with Spanish-speaking claimants, which was very special, especially for the state who shared with us that they had never been able to do that kind of research before. And the insights that we learned from that project were so powerful that we are now trying to, creating a way to, or we're now looking at how do we create shared resources from that project that we can then make available for free to any other state who's going to have to do this exact same work. And there are many states who are going to have to take on, many of these states have to take on the exact same work, and it is so inefficient that most of them are doing it all independently, and they're not able to really share work with each other. So that's where we come in. We're hoping to, be that bridge, between states and say like, oh, hey, you're dealing with this problem. We saw so-and-so over here solve it in this really great way. Here's how they did it. Here's how we can help provide the information and the resources to help states get things done more quickly, more efficiently.
I also wanted to build off that great answer, Marcy, and say that this is building out communities of practice is something that USDR is interested in doing across all of our different focus areas, not just unemployment insurance. We see when a lot of government partners, they come to us, one of the first questions they have is, how are other people solving this? And we see, so a lot of folks are building things out kind of in information silos and redoing a lot of work. So this is definitely a place that USDR is very interested in. I will also say we're at the very beginning of building out our communities of practice. And so if you are interested, feel free to jump over to that link that I just put in the chat, usdigitalresponse.org/contact us. Basically, you can use this form to fill out whatever questions you potentially have. That'll get you in our system, and we can then have you flagged there as we do build out these communities in the future that you're potentially interested in unemployment insurance, you're potentially interested in grants management tools, you're potentially interested in election modernization work, things like that.
Oh, this is another really great question from Christine. How was the solution introduced or received by state workers? How successful was the rate of adoption of the tool? So luckily, the states that we did talk to don't need this tool anymore because the blanket waiver was issued in February. So the states we talked to, they were very stressed out, basically about having to do this. And so typically we got, I want to say, 2 reactions from the states that we did demo this to so far. One was that actually most states we talked to, they kind of first, we sound too good to be true. I think a lot of times they're like, wait, nothing in life is for free, right? Or at least nothing good is for free, but we really are free and we really are non-conflicted and nonpartisan, and we have highly skilled volunteers, technologists creating these really amazing tools. And so that was the first reaction we got. And so they're kind of skeptical because they're like, I don't know, this is a really complex issue. And you're saying that it could be, addressed in this this way that sounds too simple. And then the second was that we encountered a lot of reluctance on the part of state workforce agencies to even want to do this period. Because a lot of them were, this idea of doing something this complicated that would potentially make people who were entitled to their benefits, something that would potentially make them have to pay that back, so like 2 years later. And people collect, people were, some people, it's in the thousands of dollars, and that money has been spent already. So those were the two, I would say, the reactions we got from the states that we did demo to.
And I would also just say in general, like to the point of this was not necessarily a policy priority, and so the uptake of the tool itself was not top of the mind for everyone. The inverse is also true. We've seen that if something is a policy priority, suddenly people are a lot more willing to be flexible on the solutions that they end up using. So, for example, COVID-19, that was a really great example of a time when suddenly huge policy priority, none of the existing systems were working. And suddenly people got very creative and thinking out of the box and being willing to use solutions that they otherwise normally would have turned down.
Yeah, and I want to note we have 2 minutes left, so I want to get to maybe 1 or 2 more questions quickly from Kelsey. How did we evaluate all the accessibility of each product we use? So we always have a team of our designers always follow federal accessibility guidelines for everything that we design. And there's a really great resource. Actually, the website, the link escapes me, but there's a really great resource available through digital.gov that covers, all of some really great accessibility guidelines. Let's see, let's try one more question.
I can take the one from Brendan, the next one here. How did you quickly get approval for HIPAA with the no-code, low-code tools you're using? Cities and states seem to be very slow in security around PII and PMI. This is true. The thing is, we chose tools that were already HIPAA compliant, like they were already compliant with it. So we ourselves did not need to do extra work, except maybe to point out that they were HIPAA compliant. Neat. Any last words you want to leave them with, Marcy?
Visit our website. We have a brand new website that we're pretty proud of, usdigitalresponse.org, and we'd love to hear from you all. So thank you so much for joining us today. It's been really fun, and we're really honored to be here. So thank you.
Definitely. And as always, to any government public servants in the room, if you have some technical issue or some question that you want, maybe someone to bounce ideas off of, any way we can help, that is what USDR is here for. We are here to ask, how can we help? And then follow up on that. So there we go. Thank you all.
Thank you, everyone.